Pelvic organ prolapse is an reproductive health issue. Look at this picture shows the types of prolapse. Ultrasound findings and MRI studies. Look at this detail going on. Introduction. Pelvic organ prolapse is a common condition affecting women, particularly those who have gone through childbirth, menopause, or have other risk factors. It occurs when one or more of the pelvic organs descend from their normal position, often causing discomfort, functional impairment, and psychological distress. This document explores the various aspects of POP, pelvic organ prolapse, including its causes, types, management strategies, and preventive measures. Etymology. The term pelvic organ prolapse comes from Latin, with pelvic derived from pelvis, meaning basin or hollow, referring to the pelvic region. Organ is from the Greek organon, meaning a tool or instrument, and prolapse originates from the Latin prolapsus, meaning to fall or slip down, indicating the descent or pelvic organs from their normal position. A definition. Pelvic organ prolapse is the herniation of pelvic organs such as the bladder, uterus, rectum, or vaginal wallet into or through the vaginal canal. It results from the weakening of the pelvic floor muscles and connective tissue support. One, cystocele, prolapse of bladder into the vaginal wall. 2. Rectocele, prolapse of rectum into the vaginal wall. 3. Uterine prolapse, descent of the uterus into the vaginal canal. 4. Androcele, prolapse of the small intestine into the vaginal wall. 5. Vaginal wallet prolapse, prolapse of the vaginal apex, often following a hysterectomy. Look at this picture, shows the different types of prolapse. Causes. 1. Childbirth trauma. 2. Chronic constipation. 3. Obesity. 4. Menopause and decreased estrogen levels. 5. Chronic coughing. Example from smoking or lung conditions. 6. Heavy lifting or strenuous physical activity. 7. Genetic predisposition. Risk factors. 1. Advanced age. 2. Heredity means number of childbirth, especially vaginal deliveries. 3. Prolonged labor or instrumental deliveries. 4. Family history of POP. 5. Connective tissue disorders. Example Ehlers Danlos syndrome. 6. History of pelvic surgery. Complications. 1. Urinary incontinence or retention. 2. Bowel dysfunction. Example constipation or facial incontinence. 3. Sexual dysfunction. 4. Recurrent urinary tract infections. 5. Emotional distress, anxiety or depression. Pathophysiology. Pelvic organ prolapse (POP) occurred when the pelvic organs such as bladder, uterus, or rectum descend from their normal position due to weakened pelvic floor muscles and connective tissue. The pathophysiology of POP can be break down into following step-by-step process. 1. Increased abdominal pressure. Activities that increase intra-abdominal pressure such as pregnancy, childbirth, chronic coughing, heavy lifting, or obesity put stress on the pelvic floor. 2. Weakening of pelvic floor muscles. The pelvic floor muscles and connective tissue such as ligaments can weaken due to aging, hormonal changes, especially menopause, and repeated strain from pregnancy and childbirth. This leads to reduced support to the pelvic organs. 3. Damage to connective tissue and ligaments. Over time, ligaments and fascia that support pelvic organs, including the uterosacral ligament and pubococcygeal ligament, can become stretched, torn, or weakened, leading to a loss of structural support. 4. Descent of pelvic organs. As the supporting structures weaken, the pelvic organs such as the bladder, uterus, or rectum begin to descend into the vaginal canal. The degree of descent can vary from mild cystocele rectocele to severe complete uterine prolapse. 5. Disruption of normal function. As the pelvic organ shifts position, they may interfere with normal bladder, bowel, or uterine function. This can lead to urinary incontinence, constipation, or difficulty with vaginal birth. 6. Exacerbation by hormonal changes. Post menopausal women experience decreased estrogen levels, which can contribute to further weakening of pelvic floor tissues and worsen the prolapse. 7. Development of symptoms. Symptoms may include pelvic pressure, uterine incontinence, vaginal bulging, and in severe cases, organ protrusion outside the vaginal opening. This process results in the clinical conditions of pelvic organ prolapse that can vary with severity and may require management through pelvic floor exercises, pessaries, or surgery. Signs and symptoms. 1. Sensation of vaginal fullness or pressure. 2. Visible bulge in the vaginal canal. 3. Difficulty in urination or defecation. 4. Lower back pain. 5. Dyspareunia, pain during intercourse. 6. Urinary frequency, urgency, incontinence. 7. Vaginal bleeding or discharge. Diagnosis. 1. Physical examination, pelvic examination to assess the extent and type of prolapse. 2. Image studies, ultrasound, MRI, or dynamic pelvic floor studies for detailed visualization. 3. Symptom assessment, use of validated questionnaires like the pelvic floor distress inventory. 4. Urodynamic studies to evaluate urinary dysfunction. Nursing diagnosis. 1. Impaired urinary elimination related to bladder prolapse. 2. Risk for infection related to urinary stasis. 3. Sexual dysfunction related to pelvic floor weakening. 6. Disturbed body image related to visible prolapse. 7. Chronic pain related to organ descent and pressure. Management, medical management. 1. Passive devices, non-surgical support for collapsed organs. 2. Pelvic floor physical therapy, strengthening exercise like King's. 3. Medication, estrogen therapy to improve tissue integrity. 4. Surgical intervention, options include vaginal or abdominal repair, mesh augmentation, or hysterectomy. Nursing management, 1. Educate on pelvic floor exercise and lifestyle modifications to assist with pessary fitting and care. 3. Monitor for signs of infection or complications. 4. Provide emotional support and counseling. 5. Advocate for multidisciplinary care, including referrals to physical therapist or specialist. Treatment options. 1. Conservative management, lifestyle changes, weight management, and physical therapy. 2. Non-surgical devices, accessories for structural support. Look at this pictures. Shows that accessory devices to managing pelvic organ prolapse. 3. Surgical options, reconstructive surgeries including sacrocolapopexy. 4. Hormonal therapy, local estrogen creams for tissue health. 5. Behavioral interventions, bladder training and dietary adjustments for bowel health. Psychosocial medicine, 1. Support groups, facilitating peer support to reduce stigma. 2. Counseling services, addressing emotional and psychological concerns. 3. Educational workshops, increasing awareness about POP and management. 4. Stress management techniques, incorporating mindfulness and relaxation exercises. 5. Empowerment strategies, encouraging self care and active participation in treatment. Prevention, 1. Regular pelvic floor exercises to maintaining a healthy weight. 3. Managing chronic conditions like constipation and respiratory issues. 4. Avoiding heavy lifting and high impact activities. 5. Timely treatment of pelvic floor injuries post childbirth. In conclusion, pelvic organ prolapse is a multi-factored condition requiring a comprehensive approach to diagnosis, management, and prevention. Though medical, surgical, and psychosocial interventions, patients can achieve symptoms relief and improve quality of life. Educating women on early signs, risk factors, and preventive strategies remains crucial in reducing the prevalence and impact of this condition. Thank you. Have a nice day.